how do we get people to understand how to work on our own bodies to stay healthy? And what I'm going to show you, that's why I didn't lose my shoes or anything. I took them off specifically for you guys. I want to show you lying in bed. Can you start even before you get out of bed, getting your body warmed up to stay healthy? Okay, I'm going to grab a chair in a minute. Let me grab my ones over here. See my pencils. I call them. Okay. These are tools sometimes people can use to get your body warmed up. A golf ball, if your cousin plays golf, I can bring some next time too. Or a baseball or a tennis ball. Anything that works, that has, if you want to call it, there you are. I was waiting for you the whole time. Exactly. So how do we work? How do we use things we can have around the house? A tennis ball, a baseball, a golf ball, whatever you have available to get your body to slowly learn a routine to stay healthy, have good balance, and have good posture. Okay, so this will be my bed for the day. Sometimes it's like in trouble. Okay, what I'm going to do is show you, before I even get out of bed, can I use these to get my ankle and feet warmed up so they're ready to go for the whole day. Okay, and again, use it if you want to, but can I use, for example, my son's baseball and slowly do circles with my feet before I get out of bed, get my foot and my ankle warmed up. But what else am I using too, muscle-wise, you think, when I do this?
All your legs.
My whole leg, right?
Your whole leg.
My knee, my hip, everything. Even though the focus is here, my whole body's moving in that direction. Okay? So for me, if I'm going to do this, I'll do 10 circles one way. This is counterclockwise, I think, right? And clockwise the other way. I'm a specialist, so hey, I pigeonholed in one profession. That's it. Don't ask me to add 2 plus 2. I don't know what that is anymore. Okay. So after I've done 10 on one, what am I going to do? Switch sides. Okay. You always want to do one side and then go to the other one. At that point, you let the whole leg warmed up. As I'm doing this, now this side's resting. Okay. Now you're warming your whole body up. I go up on my hands like this. This is what I do. Okay, but you can lie down if you want to all the way. Okay, and again, when you're doing this exercise, rolling the one way 10 times, the other way 10 times to rolling your feet, the ball underneath it. You're working your ankle, working your knee, working your hip, even part of your back too. You're getting everything warmed up for the day. Okay, at that point you don't jump out of bed and fall on the ground and get embarrassed or something. Pride factor. We all have that.
And you're doing reflexology also.
You're doing, that's what it is, right? Okay? Yes.
I sleep with a roll under my knee, so would I still be able to do it?
Exactly.
And just lay down while I'm
lay down, do it. Exactly. Okay? And reflexology is part of, what is reflexology? I don't know what that is anymore. What do you guys think that is?
Oh, it's just the points on your feet.
So you're causing points on the feet to get, if you want to call it, stimulated. So at that point, things wake themselves up. A lot of us wear socks all day long and shoes, okay? Especially when it gets cold. So our feet don't have that sensation and blood flow it needs to keep yourself healthy. Okay, if you have type 2 or type 1 diabetes also, you want to do this to keep that circulation going. You forget about that.
Yeah.
Okay? Yes?
Do you do it for your hand too?
You can if you want for the hand, but that's my next talk.
Oh, okay.
You have to show up for another time for that one. I don't want to give all my secrets away. Okay. Yes, sir.
I have a question, and that is, you do all of this nice warm-up.
Yes.
And then you put on shoes, and women put on these stupid high heels.
Yes.
That
Sometimes.
can't possibly be.
That's where you go, though. I don't go to those places.
And then I put on men's shoes, and I've always had these pointed toes,
Yes.
so my toes are pointed in. So what do you recommend in the way of shoes after you've done this?
Once you've warmed up your body, you can put on whatever shoes you want to put on. But you've done the hard work, if you want to call it that, to make sure you're ready to go for the day. You've warmed your body up from your feet, reflexology, and you're using the ball to get touching on your feet up when that pressure point, moving all the ball around that area. At that point, you're getting the ankle, knee, and hip warmed up, so now you got all the blood flow to the lower body. Now you're ready to go. You move your joints somewhat, Gloria, but not a lot yet, to where now we haven't loaded anything yet. Okay, so if I'm going to use this, and I have some tender points in my feet, if I want to go at it one more time, I'll use my yellow Callaway ball that I didn't lose on last Thursday. I lost all the other balls I had in my golf bag. And do the same thing. Maybe do 4 or 5 one way. And now when you use a smaller ball, so I'm going to have more sensation and more points I can get in there if I have any spots in my feet that are tight. The biggest thing that I see when I have patients in my office that have foot problems is they don't stretch them enough. And when I go from the bottom of my foot, from the front, the forefoot to the heel, that arch area needs to be stretched. You have to stretch your arch. If not, it gets tighter. When you take a step and it gets too tight, it can tear or strain. Okay, and realize that arch is a ligament from in your plantar arch is an extension of your actual calf muscle. If you have tight calves or cramps here, you're more prone to have a strained arch. And that can even cause a heel spur too. Okay? I should have had a pedicure before I came here. Now that I think of it. Yes.
Nobody's ever told us that.
I have a question.
Yes.
Using that ball.
Which one, the tennis ball or the
Either
okay,
one.
Got it.
If you have a neuropathy,
Yes.
how is that going to affect your neuropathy?
It depends on where the neuropathy is coming from.
Mine comes from my spine.
So if it's coming from a nerve in your back, down your leg, sometimes on a sciatica,
Mhm.
you can affect that nerve to become more sensitive. Or if you're making the joints want to move more in your feet, ankle, hip, and knee, where the nerve goes through the muscle, allows the neuropathy to become less of an issue, less symptomatic. The more we can move our joints, the more the muscle relaxes, and the more the nerve calms down. A lot of the nerve travels through, sometimes especially the hip and glute area, through the piriformis muscle, which is from the back across the hip area, along with the G medius muscle, which is part of the glute muscles too. That nerve goes right through that muscle. So if you get things loosened up over time, your overall body will get less nerve pressure, even though initially you might have more nerve pressure because you're causing the stretch. So you got to have your tolerance. Where am I? Check with your doctor too. How much can I do, and can I work around that? Okay? If that nerve travels, for example, the C1 nerve root, or S1 nerve root, someone coming in?
No.
I don't know so much.
Okay. He's like, I don't know what I want to do. There's too many things already. So to answer your question again, if that nerve goes from the back down the leg, say for example S1 to the big toe, you want to make sure the inside of your foot may be more sensitive. So take these the first time. Exactly. Okay. So you have to be careful where the sensitivity is and work around that. But if I'm going to do things, I'm going to stretch out my whole leg to make sure that nerve calms down. Yes, Deb?
Does this involve that
Plantar fasciitis, yes. That's the word I was looking for. Okay. Plantar fascia, by definition, is from your forefoot to your heel. That whole area is a tendon, called the fascia also. Gets very tight, causes even flat feet. But if you keep that loose, along with your calf muscle, which we'll go over in a second, at that point allows that area not to tighten up.
So you wouldn't have to wear orthotics?
I wear them no matter what. That's my routine because I tore my arch doing a triathlon in the Mount Baldy run a couple years ago. That's my routine, but I still stretch everything too to make sure I stay loose before I leave my house in the morning and go to the gym. That's my routine. But you have to figure out what works for you. If you have flat feet, they're more prone to almost sometimes tear too.
No, I wear the orthotics. It's just moving them from shoe to pair of shoes.
That's one of those things I do every day. If I don't, I feel the difference. Because I'm used to that arch support versus not having it. Once your feet flattens out, now the tendon's more stretched out, that's easier to tear versus the tendon has some room to work with. When you lose the flexibility, at that point you're more prone to tear it or even strain it too.
But
Yes.
the yoga teacher says go barefoot.
Everyone's different with
I
that.
know.
And if you're raised that way and you have good arches, phenomenal. But because all of us were told we had to wear shoes going to school, most of our institutionalized in elementary school and high school, we couldn't go barefoot. We kicked out of school again, unless we're in Hawaii or something like that in Fiji. I love Fiji, but I didn't grow up there. So because of that, our feet are developed a certain way. We have to kind of minimize the change that way too. Yes.
I've had plantar
Fasciitis.
more
Yes.
than once,
Mm-hmm.
and what I found, I use baseball,
There you go.
but what also helps is that first step that you
Mhm.
take is painful. So I use a towel
Yes.
and pull this way, and that really helps.
And that's the thing, if you can use things around that you have already, that point warm your body up. Because when you're sleeping, realize when I'm sleeping, right, and I'm on my back or stomach, everything in my lower body is going to tighten up on me. If I have straight already, it will naturally relax and tighten. So I have to be careful before I get to bed and almost do some range of motion to assess yourself. Where are you? If you have a routine in the morning, okay, I'm going to get up before I do anything. For me, I turn the pot of coffee on first, then I go to my stretches. And then at that point, I know I'm going to roll everything out, do certain ones. As you do it more and more, it becomes your habit. Even when you feel good, you do them because you want to continue feeling good. You want the excitement of having pain every day, or not knowing if you're going to have pain every day. You want to make it a routine, in my sense, an easy way not to think about it, but do the same ones every day. Every day, every day, every day. At that point, you know your day for the day. That's your insurance policy. That, hey, look, I'm gonna have a better day or less risk of injury if I do these every day. So my routine is doing my stretches every day, every day, every day. Doesn't matter if it's Monday through Sunday or whatever 8th day there is. Okay? But how do you maintain a routine? Whatever you're gonna do. If you have sciatica, if you have back pain, how do you stretch your back? If you have neck pain, how do you stretch your neck every day? How do you strengthen? How do you move things around? Find your routine, so I tell people, and do something, because unless you don't get out of bed every day, your body's going to be under some type of physical load and stress just by getting out of bed. The biggest stress we have in our body is gravity. 9.8 grams per something squared or something. Okay? That's about 10 grams on your body all day long. And if we're having that, then our body's not in a normal, relaxed, loose position, we can cause a strain, cause injury, and over time, we'll throw off our balance, throw off our posture. So by doing things like this, it allows you to, as you know, to get your body to stay loose, stay strong, and your insurance policy not to fall or cause muscle strain or injury. I stretch every day because I like to lift heavier weights for me, so I want to make sure I don't hurt myself. That's my insurance policy. I can push heavier weights, not come home limping again, have my wife laugh at me again. Okay? She humbles me sometimes, or all the time. Okay? So we've gone through the baseball with our feet, and also the golf ball with your feet. If you so inclined, get those deep spots in there. Now I'm going to do, I don't have to bring my roller with me, I'm going to take that same tennis or baseball and lie down, straighten my knee out, and use that baseball or roller or even a water bottle, as long as you close it up pretty tight, and roll it all the way back and forth. We talked about how the calf muscle extends out underneath the heel to become your plantar fascia, your arch, your foot arch. So why not roll that out too, back and forth, to make that area loose too. And your calf muscle attaches from your back of your heel to above your knee. So what I do, I always go up, because I have, in my sense, I think I have longer legs, so I'll go here first, from the heel, halfway up, the belly of the calf muscle, halfway up my lower leg, and then I'll switch, start it at the halfway at my calf muscle on the middle part, and then go up below the knee. So I'll get all areas and loosen things up that way and do about 4 or 5 passes to make sure everything in there is loosened up before I switch legs. Okay? I just make stuff up in my head every day. That's all I do. Other side too, again. Now that we've done this side, the right side in a sense, go to the left. Start with the heel, work your way from the heel all the way up. Mid calf, probably a water ball would be easier to do too. All the way up. And then for me, switch, middle belly of the lower leg, and then go right below the knee. So you have those areas loosened up by the time you're ready to go. Okay?
Why don't they teach you this in PT?
Because you wouldn't go to PT then. You got to pay your copay. Come on now. You can't survive just on what the insurance pays. You got to keep the building going. Okay. After I've done that, yes, sir.
Well, I'm just remembering something I learned the
I was
hard
going
way,
to ask
and
that.
that is, there's a difference between flexing and stretching.
Yes.
And it turns out you should do the flexing first and soften them up, and then after your muscles have gotten warm, you may want to hold a stretch for 10 seconds at least,
It's America, so
Otherwise,
you can kind of go whichever way you want
Otherwise,
to
when
go.
you're exercising and pushing, they'll tighten up and be worse.
Well, the biggest thing doing it this way, there's no load yet. There's no extra pressure to cause the muscle to become tense. We're going to get there. What we're going to focus on now is how do you do things lying down. There's no load. There's no muscle tension yet to cause that you stretch. We're doing now is more reflexology, more using other utensils. I'm going to call them utensils. I don't know if that's true or not. At that point, to make our body loosen up without the muscle tension yet.
Flexing.
There you go.
Yeah.
Next part here is lying on your back. Is figure 4 with your knee and ankle. Putting my ankle by my knee, if that's practical and possible, and just rotate your foot back and forth. Again, more joint range of motion this time. Maybe 5 times one way, then switch sides, other way. And listen to your body. If something feels sore or tight, okay, what is that? Where is that? Where is that located? My ankle, my foot, my knee, what's going on? Okay? When I'm doing this, I'm working both my feet, but realize my feet doesn't have a lot of muscles in there. They're not meant to have that. Not because I don't work out my feet, because I work on my feet. But all the muscle comes from is your calf and what's called your tibialis anterior on the front of your leg, your shin muscle. Those muscles control your ankle motion. So when we're doing that motion, we're allowing those muscles to loosen up and get more blood flow. When I stand, I want to make sure if I'm going to be off a little bit, I want to make sure my muscles can catch me. They're woken up, ready to go. If I stand on the floor and I had my grandkids over, whatever, as my kids over, unless I'm on the floor last night, I'm not going to see in the dark. I'll make sure I can catch myself if possible. So again, I'm going to come here, rotate my foot one way, 5 times, other way 5 times, and switch legs again. Let that leg rest a little bit and rotate this way. Okay, that one I'm getting my ankle loosened up, my ankle joints, and also my lower leg muscles to loosen up. Those muscles loosen up without load yet. Okay, any questions about that?
We used to call that clockwise and counterclockwise, but with digital watches, you just can't figure it out.
I was going to ask you about that. Point of interest. Got it. Okay. So next is how do we get the knee to loosen up? What's the best? What do you guys reckon? What do you guys do for the knee usually? What's your preferences?
Yoga.
But lying down, if I'm in bed, can I, because it needs a hinge joint, right? Hinge joint, okay? Hinge joint. Try to say it properly. I'm going to go here, just hold my hand behind my knee, let my leg go up, then come back down. Where I can go, as far as I can go, and maintain that position. Maybe 4 or 5 times one side, switch sides, 4 or 5 times this way. Okay? By doing that, you're getting your lower and upper leg above the knee and below the knee to work properly. You're getting the hamstring behind the knee, behind the upper leg, hamstring to loosen up, along with the quad muscle to loosen up too, by the kneecap. So
Now while you've got it up, try flexing it.
That's true. If you can get your whole body to loosen up this way without load, then you're ready to basically not get up completely, but you can get your body to feel good by doing those exercises. Okay, is that something that's easy to do? Even if you have a shoulder or upper body injury, get your body loosened up for the day. Any questions about that? Easy stuff, right? Next part, this is a hard part.
I have a question.
Yes, ma'am.
There are some of us in this room that really can't get down on the floor and get up.
Good, so
Can
I would-
this be done on a bed?
Actually, on your bed, yes. When you get up in the morning, grab the tennis ball and yellow golf ball by your bed everybody has, and do your stretches.
Okay.
Okay, and doing them on the bed so you're going to have more softness in there, so a tennis ball or a golf ball won't feel as rough either. Okay, so that's a good thing to start is everything before you even get out of bed, get yourself ready to go. Okay?
Thank you.
You're welcome. The next part here, I find my golf ball over here. Took off on me. Now we've done it lying down. If we're so prone, let me change my angle here of the camera. Can we now do with more load? This is what you can do probably if you're getting out of bed or maybe throughout the day too or before you go to bed also, is now I can sit up and do the same thing that now we talked about earlier. Now we're going to add some load to it to make the muscle really work. To really loosen up. To really wake up the muscles. Now we've woken up a little bit lying down. Get our whole foot to add some weight either from just your leg itself here or use your hand and push down just a little bit. So you control the tension and load on your feet. All right, and I'm not a foot person. This is very comfortable for me. Okay, but I want to make sure you guys know what can you do if your foot, if you do have plantar fasciitis, if you do have a tight muscle.
Myself, that's
Yeah,
kinda hard.
whatever works for you. But can you do things if your foot's sore throughout the day, or end of the day, or in the morning too, if it's tight, to get your foot to loosen up? Drinking your cup of coffee or watching TV. You know? Other side too. Always switch right to left, left to right, whatever you want to do. Maybe hold it there for maybe for 15, 20 seconds or so. And just figure out your routine you want to do, what's a good time for you. For this one, not in bed, to do throughout the day. Okay, again, with more load. Same thing, take my golf ball, find those little knots in my feet too, and slowly move things around. So again, I'm moving my foot around, with my ankle and my knee working together, the same thing, to allow more proprioception. You know what proprioception is? It's a big word. I was like, it's more than 2 syllables, so it's hard. I looked it up myself. Okay, it's for your balance. It sends signals from your ankle, from a joint, to your knee, to your hip, to your spinal cord, to your brain. Tells you where your body is. When I take a step here, my proprioception, my front foot or my heel tells me where to maintain my balance. My body recalibrate really quick to make sure I don't fall. That's proprioception. Okay? So by doing this, like reflexology, you're waking up all those nerves to have a fast reflex response. Again, to help you learn how to maintain your balance and posture and not use your health insurance to go see your physical therapist. All right? You avoid your doctor visits.
Is that a golf ball you're using?
That's a golf ball. That's the one
ping pong ball.
That's one I didn't lose on Thursday. Still kept this one.
They also sell those little gadgets that you can sit and roll.
You can do anything you want to do. I have in my office. I use weights and I use water bottles. You know, I whatever you can have around the house you can use that can roll on. That's even a roller. People go, I have really tight legs, so take your roller. My daughter does make stove from, and just roll out your legs. Move things around that way. You have things around the house. I don't know what you would use like for a hatchet or an axe. I don't know what you do that around the house for your body, but maybe, I don't know. But can you use things around the house that you can have ready? Or if you have
rolling pin.
rolling pin, that's exactly. That's my daughter. That's what it is, rolling pin. At that point, I had a patient do that. She had rolling pin. I'm like, use that for like, don't buy one of those $30, $40 rollers. Just roll it out that way. But by knowing what you're doing, and the whys is, if I can get my proprioception of my feet to warm up, my body, I'm going to have a better day. That's my insurance policy. That I'm not going to use my insurance. I'm not going to make a hospital visit. Okay, by doing this. If so inclined, up to you, can stand up and do the same thing on the side of a chair to now add in some of the hip along with the lower back for movement too. Okay? That one going back and forth the whole time. Any questions about that? This is the bonus. Make sure you pay attention to this one.
Even the hip, that's
Yes.
where I would deal with the hip.
So how do you do this with the hip? Allow things to move. So for me, for a hip issue, I would even lock out your knee a little bit and just go back and forth. That's when you're making this area handle the load and this area move.
And the one that hurts you, you do it all.
Exactly, because that would be less load on there. You can just transfer all your weight, most weight on top of your hip next to the chair. Over here on my left side, in this situation, that point my left foot's holding most of my body weight, and here, move things around.
So if something doesn't hurt when you're sitting, but when you're walking, it hurts.
Now how do you stretch that when you're sitting or lying down so it doesn't hurt? Does it hurt more in the joint or more in the muscle?
Right in the joint of the hip.
So in the hip area, what I would do is here, seated, this is a bonus. Right hip, correct?
Yes.
Okay, I'm going to take my leg. Can we do this? Much as you can. Okay, and then, with a face is okay too, with a grimace. Then from here, once you're figure 4 with seated, figure 4, with your knee, with your ankle on top of your knee, of your knee. At that point, take your hands either underneath your hamstring this way, or underneath your knee this way, and pull your knee to your opposite shoulder. Like the grimace. I like the grimace. Because you're stretching the muscle out. You're making the muscle looser. The part of that muscle called the piriformis, that side muscle of your hip, allows you not to push your hip out when you walk. By doing this, allows your body to loosen up before you even do anything. Okay, let me check you one more time. Make sure you're in the right way. Let's see. Okay, so I'm going to come here. Right there. Good. And from there, bring it up this way. There we go. You got it. Toward that shoulder. Make the face, exactly. I think you're doing it right. Make the face, you're doing it right. And just bring it. And again, you made a good point though. When you stretch, you should stretch only to where it feels sore, maybe tight, but not painful. If it's down is okay too, it's inside hip, but when you're pulling up, it's outside hip. But you're pulling up is outside. But if you're pulling to where it hurts, where it's painful, that's not going to be good. So make sure you stay below that range. Anytime you do a stretch and it hurts, you got to hold off on that stretch. You want to bring that knee up, hold it for about 10 seconds. Good. And then relax it, then go up a little bit more. Next time, all the way over as far as you can.
So does it hurt because you stretched it?
Yeah. It's a miracle. You're healed.
I don't know if you said
Yes.
this at the very beginning because I was late.
Yes, sir.
But the best time to do some of these is before you even get out of bed in the morning.
That's
Why?
you read my mind.
Did
Yes.
you say that?
Yes.
Yes. I'm consistent. He comes to all my seminars, so he knows me too well. You just want to repeat that to make sure, remember to do it in the morning before you get out of bed. Because that's what we don't think about stuff, right? We're asleep. I'm half asleep. Was it Monday? We had seen with the USC game on Saturday. I came home late. It was a late game. And woke up like at 7 o'clock on Sunday. I'm like, oh, that's not good for me because next day I used to get up like at 4:30 to go to the gym. I guess my alarm went off on Monday morning, and I had no idea I was out. My wife does this. She texts me, and I just freak out. I go, what is going on here? That's just me. But that throws my whole schedule. Obviously, I wasn't even awake. But I get out of bed. I do my stretches. I have my coffee machine will go off when I get back from the gym. Do my stretches for about 10 minutes. Go to the gym, work out, come home. Now I'm awake. I'm ready to go. But what does it take you? Are you a good? I'm not a morning person. I am a morning person, but I get out of bed first to be a morning person. I don't even hear my alarm clock go off. I have no idea what's going on. She freaked me out. I don't know what's going on. Every time she says I do that. But my thing is, how do you have a routine? And once you do it enough, it becomes your routine. For me, if I had hip tightness, just before I got out of bed. Before I got out of bed, I'll show you real quick. Turn a second so people at home can see, or home later. Is I would do this before I get to bed. If I have a hip issue, same thing. On my bed, wake up, bring that knee over, and pull it toward that shoulder. And you'll feel it more here too than if you're seated. Because now your body's more relaxed.
Will that be good for sciatic also?
It would help that sciatic nerve too, because it goes around the piriformis muscle also good.
So when people say they have bursitis, what does that mean?
Bursitis is more of there's a sac between the joints you have in your shoulder and also your hip too that allows things to have less friction. Like a little sac of water in there basically. Bursitis when that area wants to swell. When the lining of that sac gets a little bit irritated, it'll swell so it can actually heal. So that requires more heat, some stretching, but again to your comfort level. Because everybody's different.
How do you know the difference from what you're talking about?
You're not going to know unless you get an ultrasound done. But if you stretch it to where you feel good, you're doing the right thing for your body.
Excuse me.
Yes.
I had therapy and they told me my IT band was tight.
You know where the IT band is?
I think it rose. I felt it.
Good. Right here, right?
Yes, all the way down
Right there.
to my ankle.
If I have an IT band issue, okay, I want to make sure I understand what that is. IT band, also called tensor fascia lata, aka, attaches below your kneecap
Yes.
on the side up to above your hip.
But how come you feel it all the way to the ankle?
Because that whole area gets tight. Because that whole area, when it tightens up, it makes your and to the outside anterior shin muscle tight too. If something's tight, everything has to compensate to make you still walk and move around.
How do you know if you have the IC band or sciatic? Because that's kind of sciatic.
Because that would be more with motion all the time.
That's because you drive a car a lot.
But when you take a step, you're going to have that muscle activate. That would be more of a muscle strain or muscle tightness. When I'm sitting or lying down and I'm having that pain, even without muscle motion, that's more the nerve pain, more the sciatic pain. People have that usually when it gets bad enough, they'll wake up with sciatic pain. They'll get out of a chair and go, there it is right there, even before they get out of the chair. That back disc will swell. There's nerves will fire down the leg.
I think mine must be that band.
It's probably the band. Especially if it's one side for one too. But again, a lot of it is understanding your body. You do things if you know where the muscle attaches to, say here, or here, or here, or here, how do you stretch that muscle out at either the distal joint or more the proximal joint toward the spine or toward the hip? And those are good for all of it too.
But sometimes
Yes.
when they go to Pilates, we're doing upper body motions and I feel it on the leg.
Because when you're on the leg, you're having to load your lower body to hold that position. I don't know if this is a Pilates move or not. I don't know. It's made up in my head. No.
Because we're doing the whole upper thing and my legs are.
Yeah, because if you're moving your body one direction, you're adding more load to that hip. If I'm doing this, for example, again, I don't know what it is to play with, but you're adding more load to one area so that you don't want to shift your hip so it stays steady, so you maintain that hip position by causing it to tighten up. So for me, I would take the rolling pin and take that right there on the side of the leg and just rip that thing out. That's what I would do.
And a shot of tequila.
That's up to you. Don't forget the lime. I keep forgetting, is the lime beforehand or afterwards, Keela? I don't remember. I don't know. You guys know more than me. Yes. Yep, we're coming in. All right. Come on in. We're going to do a second talk in a second too. But any questions about the knee or hip or ankle? Yes, ma'am.
They usually pull it up. And sometimes different when you go down like that. Is it holding the same thing?
No, it's more of your back muscles. It's a good question. Some people do this too when they do that TFL band or the sciatic nerve and hip stretch this way. Sometimes they'll lean forward to do it too. That's more your back. I'd rather keep your back straight, bring the knee up to you, get the muscle to work, not a back stretch. All right. Any questions about that? Any other questions?
You're so good, we just know
Oh, I covered everything that never happens. Yes.
You know, this exercise for you
Yes.
it's good for fibromyalgia.
Yes. Why do you think it's good for fibromyalgia?
Fibromyalgia is everywhere. So you can do anything. Feel better.
Anytime you guys know what fibromyalgia is?
Yes.
Have you heard of this before? It's overall muscle pain, and I talked to a patient, I think this week or last week about it too. Even their doctor said, hey look, we don't know exactly what's going on in your body. We're going to call it fibromyalgia because it's called the diagnosis of exclusion. Okay? We're not sure what it is. So they say you have pain here, 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 here. There's nothing crazy about your body. There's no medical diagnosis. So they're going, well, you have fibromyalgia. You have a condition where you have trigger points around your body. There's soreness everywhere for one too. If they call it that, you got to go, hey, basically there's nothing medically wrong with me. Fibromyalgia means that there's nothing medically wrong with you. You don't have a disease or condition, whatever it is too. But you have to move more, cause more circulation to make your body feel better. Does that make sense? Okay. If my body has, you guys know what trigger points are? Trigger points? Gun massage strips, you go, there it is, right there. What happens is the muscle doesn't move or doesn't have enough oxygen in the muscle, so you use lactic acid instead as a form of energy. Okay, if I move my muscle, it wants to use oxygen as a way to cause circulation and movement. If I do too many of these, it starts to burn and gets really sore when I'm doing them. For example, runners get it too. At that point, your muscle will start using lactic acid, which is from carbon dioxide. Instead of oxygen, because you can't circulate the oxygen too quickly, use carbon dioxide instead. At that point, it builds up balls of lactic acid in your muscle. You get those trigger points that people get fibromyalgia or also myofascial syndrome too. Okay, by doing more motion, moving things around or rolling things out too, you break up those knots. You have to move things around. You have to feel uncomfortable, sometimes sore, to get loose and strong. Okay, a lot of doctors will disagree with me if they say it hurts. stop doing it. The problem, do that too long, then it hurts because you're not doing anything. Just before too glory knows, if you don't move enough, you cause rigor mortis. No. So how do we move? How do we move enough again below our pain tolerance to where we can get that pain tolerance higher and higher and higher? Where moving goes from being painful to sore to tight to relaxed. But it takes time to get there. Again, if you have sharp pain and it hurts right away, get checked out. It doesn't go away, get checked out. But most people realize, I hurt, I better stop, I'll take medication. And the muscle gets tighter and tighter and tighter. You move again, it still hurts, I'll take more medication. It's tighter, now weaker. If I don't move my joint, my elbow, there's no circulation muscle above and below. These muscles, because of lack of circulation, will weaken, shrink, and tighten and become painful with motion. So I have to move a joint that's movable. At that point, the muscle gets looser and then stronger. But knowing when to do it and how to do it is up to you how to find your routine. My routine every day is my routine because I want to make sure everything in my body is loose before I go and lift weights. Before I go and push people around all day as a chiropractor. I want to make sure I'm ready to go. So I prevent injury myself. I have disability insurance, but I don't ever want to use it. It's the plan.
I'm sure some of the ladies here can relate to this.
Yes.
For 50 years, I was getting a good hour leg exercise, flexing and everything, driving to and from work.
Yes.
5 days a week.
Yeah.
You know.
It's about this much motion.
And sometimes it
This
may
much
hurt,
motion.
but you've got to hit the brakes.
Yeah.
Everything.
Because you're not moving either.
Yeah.
Your movement is here. That's it.
Yeah, that's it.
That's it. That's it. And your body's like this the whole time, from here to here to here to here. People now, I have patients that drive to Long Beach every day, from Upland, Rancho. That's like, I don't know what you would call it, but it's not a good word. You know? So how do we, as someone who does that, to realize this is for someone that, whatever you're doing now in your life, so when you get up in the morning to at night, that's called stress on your body, good or bad. How do you negate that stress with stretching, with strengthening, with maybe some walking, some cardio, so by the end of the day, your body has balanced out, taking away that stress for your body to relax. That's the key. If you drive Long Beach every day, insanity, you got to come home and walk and stretch and ice and get yourself stronger. I have a patient, Ann, that's what she does 4 days a week.
Self-driving cars will be more deadly in one way.
Yeah, it might be safer looking at the big picture. But how do we get our body to deal with stress we do? Whatever it might be.